Public health officials concerned about a 35% spike in COVID cases nationwide in recent weeks.
The CDC says less people are getting vaccinated. Hospitalizations are on the rise. Right now, the upper Midwest is seeing the largest increase in COVID cases. And now the State Department of Wildlife is confirming some deer in Oklahoma have tested positive for COVID-19.
Yeah, that announcement comes just before deer gun season starts tomorrow. Joining us live now to talk about it, Dr. Dwayne Elmore, a wildlife management specialist from OSU. Thanks for talking with us, Doc.
Glad to be here. Thanks for having me.
First question, does this surprise you, these findings?
Not really. I mean, we've already found COVID in quite a few different species. It's been detected in dogs and cats and primates, and of course, a lot of ferrets in Europe have been detected with it. So we know that it can infect lots of different types of animals.
How do you think the deer, though, get the virus?
The thought is that it did jump from humans most likely to deer.
Really?
Because the strains that they've detected in deer match the ones that are circulating in the human population.
Interesting. How does COVID impact deer? I mean, do they show symptoms? Are they the same symptoms? Talk about that.
So far, it's not known to be symptomatic in deer. There's no evidence of that. So they're probably just serving as a reservoir that will mean it's going to be even more unlikely that we're ever completely rid of COVID-19.
Wow.
What about deer spreading COVID to humans? Is that a possibility? Is the meat safe? I mean, I think these are questions people, it's just a lot of uncertainty. What do you say?
Yeah, absolutely. The two issues are first, can deer give it right back to humans? That's unknown, but it's certainly possible. And since we don't know for sure, there's a few things that a hunter could do if they harvest a deer, because the hunters are going to be the ones that are in direct, close contact with a deer. Of course, this is a respiratory disease. So if a deer is been harvested, it's not respiring, it's not giving off small aerosol anymore. So there's not a lot of contact from that. But if you did touch the animal's mouth with your hand, and it had COVID virus on it, and then you touched your face, there's a small chance of transmission that way. So what I would advise people to do if they're handling carcasses is wear gloves, don't touch your face, and then throw the gloves away. And we would advise that kind of safety protocol regardless of COVID. That's just basic hygiene to protect yourself against any zoonotic disease.
Dr. Elmore, how did you all discover this in the first place? Was it just a random sampling just to see? Was there an issue that came up? How was this discovery made?
Yeah, last year there was some evidence that COVID likely could infect deer because it was able to bind to respiratory cells in white-tailed deer. But so a lot of states started sampling for it. And sure enough, in the Midwest, they found pretty high prevalence rate, meaning that it was actively spreading between deer. And so with that, other states started monitoring, and now we know it's fairly widespread. But I would just caution people not to be overly alarmed by this. For the long-term trajectory of the virus, it means it's going to be with us probably. But in the short term, the chances of a human coming in contact with a COVID deer is pretty low. Your risk is really human-to-human contact.
Well, Dr. Elmore, thanks so much for sharing the information with us here at 9 o'clock this morning. We appreciate you so much.
Of course, thank you.
Have a good day.